This presentation has been developed to answer common questions about allocating hours across the ASHA 9. We hope you find the information helpful. The examples you'll see are not intended to be an exhaustive list. Rather, they are provided to help graduate students and clinical educators determine how hours should be allocated to best reflect the students' experiences. ASHA requires clinical fellow applicants to demonstrate knowledge of communication and swallowing disorders and differences in the following areas. These areas are often referred to as the ASHA 9. Speech sound production, fluency and fluency disorders, voice and resonance, receptive and expressive language, hearing, swallowing and feeding, cognitive aspects of communication, social aspects of communication, and augmentative and alternative communication modalities. Students need to remember to allocate hours for informal assessment. For example, an articulation evaluation should include informal screening of the patient's fluency, voice, language, and social skills. Allocating a small amount of time, 2 to 5 minutes, in the areas that were informally assessed demonstrates the student considered all the areas of communication and made the appropriate recommendation that no additional assessments were needed. According to ASHA, students must demonstrate they have knowledge of hearing, including its impact on speech and language. The hours allocated to hearing are not based on treating hearing in the same manner as we would treat articulation or language. Rather, the hours are entered to reflect the student has had experience evaluating and treating patients with hearing loss, and that they have accounted for the impact the patient's hearing loss has on speech and language in their service delivery. Supervisors and students often allocate language hours to one area based on an overall diagnosis. To best reflect the experiences a student receives, a closer look at the areas targeted must be considered. Comprehensive language treatment addresses the patient's receptive and expressive language skills, the cognitive aspects of communication, and the social aspects of communication. These areas overlap as language needs are addressed. To ensure the experience record accurately reflects the student's range of experiences, the session needs to be divided across these areas accordingly. This visual depicts the overlap of receptive and expressive language skills with the social aspects of communication. Clinical educators and students need to separate the time spent in a session to show the student is gaining experience in both areas. Social aspects of communication is one of the more underrepresented areas of the ASHA 9 on a student's experience record. As speech-language pathologists, our goal is to help the patient communicate to the best of their ability, which includes social interactions. Therefore, social aspects of communication should be included in evaluation and treatment sessions, particularly when language and cognitive aspects of communication are addressed. Whether the graduate student is working with children or adults, one or more of the skills shown on this slide will likely be incorporated into sessions where the primary concern falls under the umbrella of language. Hours should be divided between language and social aspects. Let's turn our attention now to the cognitive aspects of communication. Pediatric evaluations and treatment sessions routinely target skills that should be allocated to cognitive aspects of communication. Please note, the visuals in this presentation are not intended to be a comprehensive reference. Rather, they are intended to help students and clinical educators consider how experiences could be best reflected on the student's experience record. When students complete their adult-based placements, the bulk of hours that fall within the umbrella of language are usually entered as cognitive aspects of language. The allocation of hours is not intended to reflect how a session was billed. The session may be billed as cognitive treatment, but for the student's experience record, it is important that the variety of skills being addressed be allocated across the areas. We encourage you to pause and review this list. If a session includes activities outside of these areas, those skills would be better allocated to expressive receptive language or social aspects of communication. Upon graduation, students should have time allocated to each area of the ASHA 9 for both children and adults. Our program does not have a minimum number of hours required for each area. Just as each placement is unique, so is each student's experience record. This concludes the presentation. If you have questions, please contact your student's externship coordinator. If you do not remember who your student's EC is, contact the SEP team at sept@usa.edu and they will direct your question to the EC for your region.